Hello, everyone, and welcome to another episode of hashtag CR Arthritis. We are speaking to you from the annual Canadian Rheumatology Association's scientific meeting. And today we're joined by Dr. Manuel Ester. He's a postdoctoral associate with Dr. Claire Barber, good friend of ACE's, at the University of Calgary's McCaig Institute for Bone and Joint Health. Dr. Ester, thank you for joining us today.
Thanks for having me. Yeah, it's great to be here.
We're going to talk about a workshop that you're co-presenting at the CR meeting, along with Dr. Barber and Dr. Stephanie Kalawi, and it's titled "Moving More with Inflammatory Arthritis: The Benefits of Physical Activity and Strategies for Supporting Physical Activity Behavior Change." And this session is designed to equip healthcare professionals with evidence-based strategies to encourage and support their patients becoming more physically active and hopefully ultimately improving their health and quality of life. Dr. Ester, this is a subject area that ACE is familiar with. We've developed a significant amount of education and advocacy activities around the subject area, including a national survey on arthritis and exercise. And from the learnings from that survey, we launched a new course in the Joint Health Education Program on arthritis and exercise. We're going to have links to those at the end. And in that work, we've uncovered sort of some of these common obstacles that people with IA have, like pain and fatigue and fear of injury, lack of guidance, education. So I thought maybe a good place to start would be for you to tell us, from your experience, what some of the biggest challenges are for patients with inflammatory arthritis when they're trying to do the right thing and stay active, and how can healthcare providers help them overcome these barriers?
Yeah, that's a great question, Kelly, and really timely. We actually just completed a kind of survey type study with patients as well, asking about these things. And so from my background, I actually have a background in physical activity behavior change. So thinking a little bit about the psychology of how people actually can adopt and maintain these behaviors. And we know it's a big challenge. So in terms of some of the challenges that stood out to us when we talked to patients, the first category was kind of around capability. So physically, psychologically, are individuals kind of able to adopt these habits? And a big piece there that I'm sure you've heard about from talking to others as well is that unpredictability of those health challenges. You don't know when those flares are going to come up. And that unpredictability makes it really hard to plan these physical activities into your day-to-day. And it throws you off a lot of that time. So even if you do plan for it, then things change, and that can be super challenging. And then another one that's really important around the capability is really adapting to your changing abilities. So, you get this diagnosis of rheumatoid arthritis, psoriatic arthritis, another condition, and things change. So you might have been doing different physical activities beforehand, or you might not have been doing different physical activities, but then things change and you have to figure out how to adapt. And we know people don't get a lot of tailored, good support around that, and that makes it extra challenging. Another big piece that really stands out is the motivation piece. And we know that for any individual, kind of staying motivated to stick with physical activity habits can be a challenge. But especially kind of when you're dealing with an inflammatory condition, especially having consistent progress and then having lots of health setbacks and that kind of unpredictability makes it extra challenging to keep up that motivation and stick to your positive mindset. So it's really extra challenging. And then in terms of the opportunity, so this is like the resources, the support. You asked about this, like how can healthcare professionals support people? The fact of the matter, and the fortunate fact, is that individuals really often aren't getting any tailored specific advice on how they can be physically active, how important it is, what it might help them with. There's kind of a lack of that. But people that do access that, really kind of getting connected to an exercise professional that has some sort of knowledge around rheumatoid arthritis, inflammatory arthritis, can be such an important factor. But in terms of the healthcare professional, the best thing to do is just to ask all your patients kind of, what are you doing for physical activity? It can be just this quick 15, 30 seconds, even to plant that seed of thinking about this as a part of their well-being and as a part of their overall comprehensive treatment.
Yeah, I mean, there's a lot to sort of unpack there because, I mean, first of all, people living with osteoarthritis, living with inflammatory arthritis, are our heroes at ACE. I mean, they're some of the toughest, most resilient people on the planet, and this particular area is something that really tests that strength and determination. Because even for the healthiest people to stay on a physical activity program regime is a challenge. There's always all sorts of challenges. And as you say, when you're living with a serious chronic disease like a type of inflammatory arthritis, it just compounds it. So I think that was a really good setup for us. And what, to keep people motivated, to keep them on track, in the face of some of these challenges and unique challenges that they have, what are the benefits? What can people sort of that light at the end of the tunnel, that motivator? So, is it reduced pain, and is it a change in their mobility? It's the overall disease management. What are some of the benefits that people can look to start a program and to stay on it?
Mm-hmm. Yeah, that's a great question, Kelly. I think I want to touch on two different aspects of that question. I think the one thing is those kind of long-term benefits. Yes, we know that's important to kind of look forward to in the long run. But in terms of the psychology, we know that looking forward to, for example, we know that exercise reduces cardiovascular disease risk in the long term. But since that's such a long timeline between you're doing this hard thing over and over again for many, many years, and looking forward to such a long-term benefit actually is really challenging in terms of motivation, because you don't see the direct correlation of that. You don't see that playing out in your day-to-day. So I can talk about some of those benefits, but really what I want to emphasize is that in terms of maintaining motivation, there's really a need to see some of that more short or medium term benefits, and it really matters to understand what's important to the individual, right? Some people are really wanting to maybe get back to a certain activity they used to love doing. Some people just want to be able to carry their groceries to and from the car and things like that. So what I always say in terms of motivation, it's really important to find your why, or help for healthcare professionals to help individuals find their why. So not everyone is kind of innately motivated to do exercise and get out there and do these hard things. But if we can connect it to something that's really innately important to them in terms of their quality of life, in terms of their day-to-day living and well-being and enjoyment of life, that's when we have the most success, right? Is tapping in, making physical activity, or I like to talk about movement in general, making that something that matters to them, is really where we have the greatest success, is when we make that link. So we can talk, I think we can talk all day about kind of the way that physical activity can help with fatigue, reduce pain, kind of even reduce inflammation in the joints, which is obviously super relevant. And there's so many even mental health outcomes that can be improved with
Right.
physical activity. So I think those are really great as a basis. But at the end of the day, I find it so important to tap into finding their motivation and finding some small wins and finding some small things to help them kind of like get that ball rolling towards thinking about those long-term benefits, maybe.
It reminds me, it became a bit of an internet sensation about, I can't remember now, 5 or 6 years ago. It was an ad from Sweden. It was a public health ad. And it was this elderly gentleman. It's the winter time. And there's no real dialogue or anything. It's just watching him. And he starts an exercise routine just using things around his home. And he's doing strength exercises. And you're kind of following him along as this ad proceeds, but you don't really know what the motivation is. It's good that he's getting active and you can see progress. And then, of course, at the end, his daughter pays him a visit at this end of this ad with her daughter. And some of the exercises he's been doing has been to lift things from the ground and up. And his granddaughter greets him, and he's able for the first time, obviously, to be able to pick her up and hold her. And I defy anybody to watch that ad and not have a couple of tears at the end because it's super effective. And I think it sort of encapsulates what you're talking about in terms of we can talk about the benefits, but it's really making sure that people have a motivation and that can keep them on track. Let's get into the actual presentation and the research that you're sharing at the Calgary meeting, and that is okay. You've summarized where the research is, but what about its real world application? That's a fancy way for us to say when an eye patient is talking to their rheumatologist about physical exercise, what is the state of that conversation and how can we maybe improve that conversation so people have a clear understanding of benefits and a clear understanding of a program or a plan that's going to get them to where they want to be. So practical approaches, best practices, and the role of interdisciplinary care, of course, because we talk about the patient being sort of the quarterback, the IA patient, a quarterback of a fairly complex team of healthcare professionals who are working with them and helping them manage their disease. So what are the findings that you're sharing in your presentation?
Yeah. So this is, I think a perfect lead. And to recap, kind of the purpose of the workshop that we're going to be leading is really to be a practical workshop with the intention to help healthcare providers and patients to understand how they can really advocate for physical activity as part of their care, but also to help healthcare providers better support their patients with that. So I think in terms of the status of that conversation and the support, I think the fact of the matter, there's kind of three things here, right? We know that physical activity is super challenging. We've talked about those challenges. And the fact of the matter is that lots of people aren't doing a lot in terms of physical activity, or maybe could be moving more here and there. So there's an opportunity there. But unfortunately, with everything else that's going on as part of that care, we know that the advice and support and counseling around physical activity is really limited. So to say it bluntly, it's not happening in a lot of cases. And then even if that conversation is happening, there's a lot of challenges there where healthcare providers don't have a lot of specific training. Some do, to be fair, but a lot of healthcare providers are telling us, we don't know how to give physical activity advice. We don't know exactly what the safety is, the benefits, how to even have that conversation. So there's a lot of gaps there. And I think the biggest miss in terms of that conversation is when you do get that opportunity. Either the patient brings it up or the healthcare provider, but then they just leave the individual with these are the physical activity guidelines, 150 minutes of moderate vigor of physical activity, strength training 2 times a week, flexibility, all these things. And if you think about that on the whole, to someone who's going through all these challenges, who's maybe doing very little or minimal physical activity, that's a big miss because that doesn't lead to anything, right? If anything, that leads to them being more discouraged and feeling like, oh, it's this huge, huge gap between where I'm at and where I need to be. And so what we always focus on, and I think one of the areas I'm really trying to emphasize through this workshop is it's really a stepwise, right? It's about building some momentum. It's about moving more. It's not about achieving some arbitrary guidelines that because that's not the only thing that can lead to benefits. You can start
Yeah.
seeing those benefits as soon as you get moving and start moving. So yeah, really with this workshop, we want to focus on that piece on how we can help individuals move more and think about, first of all, we really want to reassure patients that this is something that's safe because there's a
Absolutely.
lot of those fears. So that's number one, is getting over that barrier. Yes, this is safe. And there's guidelines from the European Rheumatology Association, from the American College of Rheumatology Association that are really highlighting that. But then after we get over that safe part, it's about tapping into finding that motivation with the individual. And here we really want to support healthcare providers to have a simple conversation with their patients. So what we've put together through this workshop, and it's based on some really nice work that we've looked at in other conditions as well as inflammatory arthritis. But we've put together this idea of the 1 minute conversation, the 5 minute conversation, the 10 minute conversation. So it's trying to figure out, we know that resources and time and capacity can be limited, but if we have 1 minute, what do we do? So if we have 1 minute, we can ask the individual about what they're doing for physical activity, maybe why it matters to them, and then maybe give one little bit of encouragement or tell them before the next time we meet, why don't you try this? Or like, think about something that you can try doing in your day to day. And then if we have more time, we can really start to go a little bit more into finding that why and maybe setting a simple goal together or something. And then really, I think one of the key pieces that I'm going to try to emphasize kind of near the end of this workshop is really the importance of following up. So in terms of the behavior change, that is so important, following up.
So sustaining an active lifestyle or a program over the long term, I think you've nailed it. And what are some of the best or most effective behavior change strategies should people with IA consider? So, is it motivation techniques? Is it goal setting? We've stressed in many of our materials about the importance of a personalized treatment plan, and this would be part of that.
Mm-hmm.
Any sort of personalized support strategies, and I'm also thinking, about technology, and it's something that wasn't very sophisticated, 10 years ago when people first got their phones.
Mm-hmm.
But now that phone is basically a personal fitness trainer in the palm of your hand if you choose to use it and if you're prepared or trained to use it. So, what about some of those strategies that people might talk about with their healthcare provider?
Mm-hmm. Yeah, thanks for the question. I think this is so important. This is the crux of the matter. At the end of the day, it's about an individual's psychology and figuring out how they're going to pick up and maintain a habit like this. So there's a lot of really good research around this, and I think essentially there's a really good statement if you go to the European Alliance Against Rheumatology or their EULAR. They have a guideline around physical activity for inflammatory arthritis, and there's really 5 key behavior change strategies that have been found to work across both this population and other populations. There's many more as well, but these are, I think, the ones that are the strongest or the most powerful from what we understand so far. So the first one, I think this is going to tap nicely into your technology question. The first one is self-monitoring. So
Yeah.
just keeping track of what are you doing, what are you not doing, that even that act of figuring out what am I doing, seeing I've got my watch on here, seeing your step
Right.
count pop out,
Right.
just knowing how much that is, things like that. Self-monitoring is really super powerful. And I always like to recommend, if you're writing it down or if there's some active component of that, where technology comes in and it's really, really useful is, this automated monitoring and tracking of physical activity and steps and things like that, which can be really, really important. But if that's all happening in the background, you're not actively thinking about it. So self-monitoring is really important, but with an active component of maybe you're writing it down, or maybe you have a moment at the end of your day where you're
Yeah.
consciously like having a look at your phone and seeing this is what I did. Super valuable. Then the second one, you touched on it a little bit already, is goal setting. And I think goal setting is something that we talk about maybe a lot, but I think there's a lot of misses in terms of goal setting becoming too complicated and too, it has to be this, it has to be like 3 goals and this time period and everything like that. While it's important that your goal is kind of specific enough, it needs to be simple and achievable too. So you need to start somewhere. And if you set yourself a goal that you can move towards and feel like you're really making progress towards, that is super motivating. You probably know it from your own personal experience, and I know that as well. So goal setting is important, but we don't want to overcomplicate that goal setting process. So pick something, try it out, monitor it. And yeah, it's important with physical activity goals. What's really important is not just to focus on kind of the end goal or the outcome. So uh, lots of people set physical activity goals around kind of like maybe a weight loss goal or like a goal to achieve physical activity guidelines or to strength train 3 times a week. But if we can make it about the process of moving towards that, that can be really motivating. So you can say, this week I want to get this total steps, so 20,000 total steps. And then you can vary day to day, and you can also build in that fluctuation of how you feel day to day. And when things don't feel so well, you give yourself a little bit more flexibility there. And then I think maybe I'll highlight 2 more. I think like the next one then with that goal setting is making an action plan. So you talked about it in
Yeah.
terms of kind of a personalized treatment plan,
Yeah.
but really breaking that down. So you have your goal up top and just set a couple things. So this is what I'm going to do this week. And again, not too complicated, not too overwhelming, but maybe it's 3 things. Here's what I'm going to do. In the morning, I'm going to do this. In the afternoon, I'm going to try to do this. And then in the evening, I'm going to look at my phone and reflect on the steps that I did or something like that. Keeping that very much like, it has to be achievable. And if we're adding all these different things to our plate and just taking away from our time to actually do the physical activity, that can also have a negative impact. And then, yeah, I think last one I really want to highlight is this idea of feedback. So I alluded to it briefly, this idea of healthcare providers. It's so important that they follow up. Why do we have regular follow-up appointments in care in general, right? We know how important that is, but even just asking a quick question around it, what are you doing for physical activity? But for individuals in terms of feedback, they can get feedback, like you said, through technology. That's that kind of automatic feedback you can get. It sends you a nice little prompt too, like when you achieve your step goal, you get that vibration. But getting feedback from other people is so important too. So when you set these kind of goals, share it with someone that you know is going to be supporting you, and then when you achieve something, let them know, and you can get that feedback going and see that progress is super valuable. So yeah, those are, I think, self-monitoring, goal setting, making an action plan, and then making sure there's some way for you to get feedback and stay in a positive space, so to speak, is super vital. And yeah, I think to your point around technology, technology from what we see in the research is a really good tool to kickstart to get people started. It's not doesn't seem to be as effective for kind of the long term. People pick up, you've experienced this when you try out a new app on your phone, or you get your new physical activity watch. The first 2, 3 weeks, maybe you're really sticking close to that. You're like super motivated to reach that step goal or whatever it is in your technology. But if we can use that as a kickstart to then wrap it into a more long-term sustainable habits, that's great. But yeah, that's I think the great thing about technology is helping kickstart that. But then there needs to be other pieces alongside that that can lead to the long-term maintenance.
That's an excellent summary. And I want to thank you because this subject area is one of the ones that we get the most questions asked about, which is why we spend a lot of time on it here at ACE, either in patient education or in advocacy work that we do. And this just adds, I think, to the information that we've been able to share with our audience. So, Dr. Ester, we value it very much, and we want to thank you for joining us today. Good luck at the conference.
Thanks so much for having me. I'm always happy to chat. So yeah, and good luck to everyone getting moving out there.
Thank you. And we will follow up with you. And at this point, I just want to thank everyone for joining us today. And we look forward to sharing with you, people with arthritis, more exciting science from the annual CRA scientific meeting. Thank you, and we'll see you again soon. Bye-bye.